Stephanie was a young adult who had her entire life in front of her. In college, she was part of a sorority and was liked by her fellow classmates. After graduation, she landed a corporate-level position in marketing. Her future was bright. That was until she got in an accident, which damaged both her frontal lobes and put her in a coma for 2 days. She hit her head so hard, it left a dent in the steering wheel. After her accident, she had very little coordination or motor skills. She had to relearn everything. Physical therapy has allowed Stephanie to recover fully from her accident and return to the bright future that was almost robbed from her. Hi, I am Molly Jones, and I will be speaking today about the effectiveness of physical therapy when dealing with a TBI, or a traumatic brain injury. My thesis. My thesis is, although brain injuries are difficult and dangerous to treat, I believe physical therapy can be used as an effective treatment for people who have lost motor skills and brain function due to trauma to a certain area of their brain. Physical therapy not only deals with the physical part of the patient, but also the mental or emotional part as well. TBIs affect not only the victim's motor functions, but also their emotional status too. Most patients are upset and angry for the accident happening, or get frustrated when their body won't cooperate with what they're trying to do. This is why their treatment must cover not just their physical status, but their mental one as well. If a physical therapist is trained to deal with both, they are able to deal with developing the patient's motor skills along with helping them sort out the emotional issues in order to improve fully. According to a study, post-traumatic stress disorder can develop after severe traumatic brain injury. The study also states the predominance of emotional reactivity and the relative absence of traumatic memories in patients with post-traumatic stress disorder who suffered impaired consciousness during trauma suggests that traumatic experiences can mediate PTSD at an implicit level. This means traumatic brain injury patients really need help in the emotional area. Physical therapy develops the brain in the emotional area along with the physical area. Motor skills are used for activities from typing and driving to sports, require practice and learning over a prolonged period of time. During practice, the brain encodes information about how to perform the task, but even during periods of rest, the brain is still at work strengthening the memory of doing the task. This process is known as consolidation. The repetitive actions performed during physical therapy allows the brain to encode the information so the next time it is performed, it won't be as difficult. Physical therapy is meant to reteach the body how to perform tasks and strengthen muscles. In TBI patients, this is very important and will result in the ability to walk again or perform a simple task as writing one's name. During a physical therapy session, the therapist will move body parts in order to reteach the brain how to control that action. In TBI patients, over 90% of them regain control and motor function after physical therapy. This treatment is also for the stimulation of the brain in order to heal injuries made. In severe cases of brain injuries, people have been put into vegetative states or near vegetative states. In order to stop the brain from completely shutting down, the brain must be stimulated. The brain is like any other muscle. It must be used, otherwise it will become weak. Physical therapy allows for stimulation of brain functions in order to keep the brain from becoming weak. Having a physical therapist come and move the legs and the arms, and even getting the patient to move their eyes back and forth, causes the brain to have to function and register everything that is happening. Every movement causes neurons to fire, which keeps the brain working and from shutting down. According to a Harvard study performed by Dr. Rady, he found that physical activity stimulates various parts of the brain, including, among other components, the brain's own endogenous stem cells. These stem cells, which naturally reside within the brain throughout life, even into the advanced decades of adulthood, are capable of becoming prompted and directed in their formation of new brain cells by external stimuli such as physical activity. This shows that physical activity promotes brain regeneration. So physical therapy must help heal even the most serious brain trauma. In conclusion, physical therapy is an effective method of treatment for a TBI because it deals with post-injury emotional issues, strengthens motor skills, and forces brain functions to occur. All of these things combine to make an effective combination of rehabilitation for someone who has injured their brain. Thank you. And here's my work site.